Hey everybody, it's Dr. Ed here with Ernstrom Spinal Rehab. It's Get Metabolic Friday, first of many Fridays that we're going to start this new series of Getting Metabolic. I just wanted to introduce to you why I'm doing this series is because I'm going to be starting to do health coaching and weight loss coaching in my office. It's one of the main things that I've been wanting to do for almost a year now, and I've been looking for an opportunity to create a platform that will increase people's knowledge so that they can come to me for a working knowledge on how they can get healthy again. Because the whole concept is, like, one of the doctors that I follow, he uses this term, and I don't think he created it, but he uses it a lot, called get healthy to lose weight, not lose weight to get healthy. So a lot of my advice and a lot of the coaching that we're going to do is going to help you get there that way, okay? Because there's a lot of really unhealthy ways to lose weight. Okay, and it's not going to lead you to good health. If anything, it could lead to some pretty bad side effects in the back end. Anyhow, so what I'm wanting to cover today is about twofold. I want to define two terms or two topics that are very related and actually are directly related and are the two leading causes towards heart disease, cancers, potentially death of COVID, because we'll just start with the first one, which is called metabolic syndrome. What does that even mean? It's a syndrome where you are metabolically unhealthy. Okay, what does metabolism mean? It's how we use and partition our energies. So if we're not using our energies appropriately, then we will become sick. And so the first symptom of this is going to be central adiposity, which means that we're holding on to our fat in the wrong places, specifically around our organs in our belly. Now, you can be thin on the outside and fat on the inside. You can be really fat on the outside and have no fat around your organs. So we're really trying to term this as you have too much fat around your organs, okay? But having fat everywhere else is usually highly correlated with having fat around your organs too, or the inability to lose the fat or putting on more fat. Okay, so you have fat in the belly. Number 2 would be hypertension, which is high blood pressure. Number 3 would be diabetes or pre-diabetic, which is the inability to get the sugars out of our blood, and we have too much sugar in the blood. Number 4 would be too low of what we call good cholesterol, HDL, high density lipoproteins, is the carrier of this cholesterol. And then 5 would be too much triglyceride, which is the molecule of fat free floating through our bloodstream. Too much of that. So again, too much fat around our organs in our belly, hypertension, high blood pressure, diabetes, too much sugar in the blood. Too low of the good cholesterol, HDL, and 5 would be too much fat globulates in our blood, called triglycerides. So, metabolic syndrome. When we're talking about COVID, the leading comorbidities or pre-existing conditions that people were having, out of that 94% of these pre-existing conditions that the CDC reported on back in July, the number one comorbidity that people had was obesity, and we can also probably similarly call that central adiposity, or just which has a lot to do with having too much fat. Now, on top of that, the number 2 and 3 symptoms that were on that list of comorbidities or pre-existing conditions was hypertension and diabetes. So let's talk about then the other big elephant in the room that everybody's trying to talk about is age. So let's get back into how did those things even get kick-started, and it's a term that I call insulin resistance, okay? And why the older we are, the more resistant or resisting of insulin we can become. So it comes down to spiking your insulin too frequently and too high of concentration or too much intensity of insulin in our blood. So it's called hyperinsulinemia. Emia means blood, insulin, the hormone insulin. Hyper means too much insulin in the blood. So hyperinsulinemia and insulin resistance can be interchangeable terms, but when we have that too frequently and too high of concentrations, insulin's sole goal and role as a hormone is to put energy into our cells. Okay. It has a couple other different little things that can do with other cells, but let's just say that the primary role and goal, the first thing that it's supposed to do is put glucose into our cells. And what is glucose? Glucose is the sugar that should be going through our bloodstream at any given time. A healthy blood level of sugar is no more than a teaspoon of glucose at any given time. And so if we have too much of that, we need, after a meal, insulin takes that glucose, that extra energy that we just absorbed from our last meal, and it tries to shove it into the cells to get it out of the bloodstream to protect us. We need insulin. Insulin is a healthy hormone. We should not have too little of it. If we do, we could die. That's what type 1 diabetes is they can't produce enough any insulin. So we need insulin, but too much is bad too. So we need to find that happy medium place where we're at baseline insulin, which is the healthy level of it. And so what ends up happening is inside the cells with insulin coming around too much, too frequently, knocking on the cell membrane and say, hey, I've got some energy, let me unlock the door and I can put it in you. There you go. Well, if it's coming too frequently and too often, the cells get to be full. And the cells will then begin to resist insulin from the inside out. They'll basically, if we had an analogy, they're sitting at the door pushing from the inside saying, no, we don't want you to put that in here. Very similarly, if you tried to put too much gas in your car, it could spell out, you only have so much limit, or putting air into a balloon, eventually it'll pop, right? So the cell learns to resist and say, time out, go away, come back when we've used the energy that you brought last time. And so the cell will then take that glucose and take it to some other cell that is more insulin sensitive. Okay, so again, we have this balancing act between insulin resistance and insulin sensitivity, okay, which is the goal of a healthy metabolism, is insulin sensitivity. So now that we're starting to train these cells to become more insulin resistant, and again, this is a training process, there is, if you do that day after day, week after week, month after month, year after year, decade after decade, and this is where it starts getting into the older we are and we continually make more insulin resistance, the more metabolically sick we can become. Because if you've started following the trend, I just talked to a patient of mine about this today for the first time, and he started already putting the puzzle pieces together. The more insulin resistant you become, that sugar that's in the blood that can be toxic at high levels eventually has to be taken somewhere else. And eventually, if you start training too many of your cells to be insulin resistant, then eventually you become sick, and that leads to diabetes. And that extra sugar that couldn't get stored anywhere else goes to the liver, and the liver says, well, I have one last place to store this. I can make it either into what we call glycogen, which is long chains of glucose molecules, which is a form of starch. That is our storage form of glucose. And if that's full, which you can only store about 400 calories worth, which is about 100 grams of sugar in that form of glycogen in our liver, then eventually there's still too much sugar. Then the liver says, aha, I have one more way to store that, but it's not going to be easy and readily accessible when you want it. If you keep doing this whole sugar thing, I can turn it into something called a triglyceride. And that triglyceride is our body's form of fat, which is 3 fatty acid chains with a glycerol ring at the one end that's tying those 3 fatty acid chains together. So, which then, if you have too much of that triglyceride, that gets stored too. And it's not about making our bodies look sexy. Sometimes it goes around the organs, and sometimes that can make you sick and damage the organs too. So, if that is going on for too many years and you think that you're nice and healthy in your 20s and 30s, eventually it catches up with you with these bad habits that increase the frequency of your insulin spiking and the concentration of it, and bad eating habits leading to insulin resistance, leading to central adiposity, leading to hypertension and obesity, and diabetes, throws your cholesterol out of whack and puts free-floating fats in your blood too. That is why we need to reverse and go back to insulin sensitivity. All right, that's what I'm going to leave it at for today. we're going to get back into this starting next week again, and further developing where the pathway of insulin resistance and how we can turn this around. If you like the content or are more intrigued about this definition of metabolic syndrome and insulin resistance because you have some of these symptoms, then you're going to want to like, share, follow this this information that I shared with you today. If you're following this on YouTube, please hit the like button, and also hit the subscribe and the notification bell so that you can get further updates about this topic called insulin resistance. All right, guys, we'll see you next time, and I'm signing out.